Good afternoon, everyone. My name is Charles Clarkson, and I am the Project Director of the Senior Medicare Patrol of New Jersey. It's a federally funded program. Every state has a Senior Medicare Patrol. And today I'm talking to you about Medicare's open enrollment. Now, most people know that every year you can make changes in your Medicare coverage. And we want to encourage all beneficiaries in Medicare to review their coverage and make any changes they deem necessary. So let's talk about Medicare's open enrollment. It started October 15th and goes through December 7th. So time is going by and you don't have that much time left. But some of the things you can do during Medicare's open enrollment is if you're in original Medicare, which means you have Part A, Part B, a Medigap or Medicare supplement plan, and a drug plan, and you think maybe the cost is getting too high because your Medigap premiums are going up and up every year, you can switch to a Medicare Advantage plan. Now, Medicare Advantage plans are plans that are approved by the government but run by private companies, and they have all the services of original Medicare. But nowadays, because of the change of definitions of what's medically related, Medicare Advantage plans are now offering other services. So you've heard in the past that it might have some eyeglass, some dental, some hearing coverage. Well, now you might even get transportation. You might get safety bars in your bedroom. You might get Meals on Wheels for a short period if you come out of a hospital. You obviously are getting some telehealth benefits. Some plans even basically give you a card, let's say quarterly, let's say for $100 you can spend on over-the-counter medications. But the real big difference between original Medicare and a Medicare Advantage plan is that in a Medicare Advantage plan, you have to go to a doctor or a hospital in the network. Now, some plans allow you to go outside the network, but you probably pay more. So it's very important that if you want to go to a Medicare Advantage plan, check first. Make sure all your doctors are in the plan you select. And there are lots of plans to choose from. But I would suggest you pick a plan with an additional zero premium. Doesn't cost you more to get these benefits. Remember, we all paid a Part B premium, whether we're in original Medicare or a Medicare Advantage plan. Now, if you're already in a Medicare Advantage plan and the network is starting to bother you, you can't get to a specialist you want, or maybe the specialist you desire is not in that plan, you can go back to original Medicare. Remember, original Medicare allows you to go to any doctor that's enrolled in Medicare. You don't have networks. You don't have prior approvals. You don't have other rules that you have to meet if you're in a Medicare Advantage plan. So those are big differences. Of course, in a Medicare Advantage plan, if you think some of these services will help you, well, maybe that's a good thing. Let's say you don't drive, and a plan would offer transportation. Well, maybe that's good for you because you can use that transportation to go to and from your doctor, or maybe to and from the hospital. So these are other things you have to do a review. Now, how do you search during original Medicare, open enrollment period for Medicare? Well, Medicare has something called the Plan Finder. Now, if you go to medicare.gov and you come up with the website, it'll allow you to open an account, and I would recommend you do that. It's called My Medicare. And it just says log in or create an account. You create an account, you have a username and password, and then you can search. You can search Part D plans, which we'll talk about in a second. You can search Medicare Advantage plan. You can even search some information they have on Medicare Supplement or Medigap plans. So one of the things I mentioned was you can go from original Medicare to a Medicare Advantage plan, which has drug coverage, or if you're already in original Medicare and you have drug coverage, well, I would recommend that every year you check and see if there's a better Part D drug plan. Why? Because these plans change every year. The premiums change. The co-pays change. The list of the formulary of drugs covered change. So just to use myself as an example, I was in a Part D drug plan. Now I'm in it through December 31st, and I did a search, and I am changing to another Part D drug plan because I could save money. Why would I want to spend more money on my drugs when I can get a plan that's probably just as good, covers all my drugs, and saves me money over the year? Now, one of the things you should know about Part D drug plans is that when you open an account and you have a My Medicare account, all your drugs will come up automatically on the search. And all you have to do is edit them. Let's say one of the drugs that came up, you're no longer on. Or the dosage increase, you can edit the drugs. And it makes life a little easier to have the drugs come up automatically. And another thing you have to know about Medicare Part D is that the pharmacies are in a network. So, and there are three really levels of pharmacy. One is a standard network, another one is a preferred pharmacy, and of course a pharmacy that's out of network. If you want to save the most money, you want to go to a pharmacy that's preferred, and then you'll be able to see based upon the search that the cost of going to a out of network, of course they don't cover you, or an in-network plan compared to a preferred pharmacy plan can be substantial. So you can make all these changes. Now the thing I wanted to mention is that doing this can be difficult. It's complex. Maybe you're not good on the computer. Well, there's a program in every state called SHIP, which is the State Health Insurance Assistance Program. We have one in New Jersey. It's also funded by the feds. And basically they give you unfettered, unbiased advice. So I'm going to give you the telephone number of the SHIP program in New Jersey. And, if you need to, call them up. This is the state number. And they will give you a counselor or the number of the program in your county because every county has separate programs. And the SHIP number in New Jersey is 800-792-8820. So don't wait. Time is running out. You have till December 7th to make changes. If you can't do it yourself or you're not familiar or you feel uncomfortable doing a search, call up the SHIP program. But remember, during the pandemic, it takes a lot longer to meet. We're not meeting with people, so we're doing it on the phone or we're doing it by email or we're doing it by Zoom. So if we're not doing things face-to-face, things could take a lot longer. So if you really need help, call up the SHIP program, make an appointment. And in some places, I know in Monroe, they actually may be doing some face-to-face, but in most of the state, you're going to find they're no longer doing face-to-face consultations, they're doing one-on-one. So that's a very quick overview of the Medicare open enrollment. If you need help, call the SHIP program and let them advise you. Thank you, and have a wonderful holiday season.